Special Dermal Punctures and Special Procedures Lecture. Neonatal Screening. Neonatal screening is important for early detection and diagnosis and treatment of certain genetic, metabolic, and infectious diseases that newborns can have. Blood spot testing for screening is performed before a newborn is 72 hours old. The purpose is to screen for 48 inherited metabolic disorders. These include PKU and hypothyroidism. Special collection filter paper is used, and it is collected after the baby is 24 hours old. Here is an example of the supplies you will need. So a gauze sponge to control bleeding, alcohol wipe to sanitize the area, a lancet, gloves, and your filter paper. Collection of capillary blood for neonatal screening you are to introduce yourself to the parents, explain the procedure, and use the appropriate comfort techniques. Typically explaining what the test is for, and that you just explain that this is to test for inherited and metabolic disorders. Most parents then understand that this testing is needed. Identify the infant properly, and sometimes infants may not have a name yet, so naming them by baby and then their last name and then their date of birth. Here's a sample of the screening card. So we will want to fill out the name, the date of birth, the birth weight, date of specimen, medical record number, weeks of gestation, and then the hospital code, the hospital information, the doctor's address, the mother's social security number, the mother's age, and then ethnicity, if it was a single birth, if it's female. We fill this all in, and then you will have spots where you will place your blood samples, which we will talk about in a few more slides. Collection of capillary blood for neonatal screening. Warm the site according to the institution's procedures. Sometimes we will use hot packs. Wash your hands well and put on gloves. To prevent contamination, do not touch the hands or gloves with any part of the filter paper during or after collection. Do not allow the filter paper to come in contact with any substances such as alcohol, formula, water, powder, antiseptic solutions, or lotions. It's really important not to damage the filter paper. As you can see here, you would then lancet the heel of the infant and then hold the heel up to the part of the card where the filter paper is. You want to make sure that you fill the circle entirely and that these are evenly placed throughout the circles. Clean the incision site of the heel with an antiseptic swab. Allow the heel to air dry. Do not touch the incision site or allow the heel to come in contact with a non-sterile item or surface. Once the puncture is made, wipe off the first drop of blood with sterile gauze. Allow another large drop to form, and then lightly touch the printed side of the filter paper with the blood drop and fill each printed circle. As you can see here, how the printed circles are very uniformly filled with a drop of blood. If the circle does not fill entirely, immediately express another larger drop. Do not add a second drop of blood to a previously used dried circle. Only use one side of the filter paper. Dry blood spots on a clean, dry, flat, non-absorbent surface for a minimum of 4 hours. Press a sterile gauze sponge against the puncture site until the bleeding stops. Elevate the heel above the body to help bleeding stop, and then check the infant's heel puncture site for late bleeding or inflammation. Dispose of the used skin puncture device in the sharps container with a biohazard label. Check the infant's bed for any equipment or trash left behind. Wash or sanitize your hands after removing your gloves and complete the remaining information on the screening card so that follow-up can be done if the results are abnormal. Place the screening card in an appropriate envelope and send it to the laboratory within 24 hours.